Hello, this is Dr. Marty Klein with another video quickie. Today I want to talk about the very serious subject of whether or not schools should be allowed to deceive parents. I trust most children to accurately know if they're hungry or cold or if they need a bathroom. I don't trust children to accurately know if they require medicine, should take math class, or if they need to lose weight. Do you? I do trust children to know if they feel uncomfortable, unhappy, lonely, isolated, or different. I don't trust children to know the best way to resolve those feelings. It's in fact our job to teach them. And the more extreme their suggestions are, the less we should trust them. I don't trust children to accurately know if they need gender reassignment, because that's a colossal response to emotional needs that most kids don't understand. If a kid insisted that their solution to feeling weird or unhappy in their own skin was to cut off a finger, we would recoil in horror. We would refuse to do it. That would not be disrespecting the child's reality. It would be a responsible reaction to the kid's distress, protecting them from their own primitive beliefs in response to their strong, unwanted feelings. Whether they realize it or not, kids depend on us for that. And that brings us to school. An increasing number of school districts, including Chicago, Albuquerque, and Las Vegas, have now developed gender support plans to guide school personnel in communicating with students. The worst part of this is that parents are sometimes left out of the plan. Some schools actually create two sets of documents about students, an alternate gender-focused one for internal school use and an ordinary one for parents. Some parents are thus actively deceived about the special gender-focused way that their child is being treated at school. Just imagine if a 10-year-old decided that taking math class was terribly traumatic and the sympathetic school arranged for the kid to be excused from it, without the parents' input and even implying to parents that the kid was still taking the class. Everyone would think that this is outrageous, even people who hate math. The forms used in gender support programs promote a gendered view of the child from the start. They use expressions such as student's gender identity and student's sex assigned at birth. These are part of an ideological narrative, not descriptions of childhood distress. The forms and the resulting plans even evaluate parents' support of a child's alternative gender story, asking, if parental support level is low, what considerations must be accounted for in implementing this plan? In other words, how do we get around the parents in implementing a child's decisions about their gender identity? Imagine that you're the parent or guardian of a child who insists on adjusting a fundamental part of their life, and that the school is wondering how to implement a plan despite your lack of support. It's a chilling thought. Note that many schools now have a process for changing a student's name and gender description in their health record, which can be done without parental permission and without even informing a parent. Gender support plans also evaluate how urgent is the student's need. Is the child currently experiencing distress regarding their gender? Note that there's no psychiatric, medical, or other professional evaluation of what's actually bothering a child once they declare their upset is about gender identity. With this school plan, they are simply reaffirmed. Distress, of course, is a pretty low bar, and it's not defined, especially for children. Imagine a different scenario. What if a kid is experiencing distress about wearing glasses or being short or being Italian? Are they handled with a confidential support plan at school? All a kid has to do to get adult attention in school is to see gender issues as the solution to their problems. As we know, when children are unhappy, they will grab at any domain that adults value, and in today's schools, that means gender. How would most people feel if a child were continually bullied at school and the school decided to handle it without notifying the parents? or if the kid were flunking most classes or had a behavior problem. Well, I think here is School Administration 101. Do not hide things from parents. The first step in dealing with children who are unhappy about their gender is to understand their unhappiness, not to agree with their self-diagnosis, and to affirm their idea about how to resolve their anguish. Agreeing that gender is the problem and the solution for any child who says so is harmful for most children. People routinely overlook that when discussing the harm suffered by trans or non-binary kids who are forced to postpone their gender or identity transition until they turn 18. It is not transphobia to treat kids who genderize their distress the same as kids who develop other sweeping strategies to resolve their distress. It doesn't take kids' struggles seriously enough, and it's disrespectful to parents. If changing gender identity is indeed the best or only way to deal with a kid's distress, it will become clear within just a few years of investigating various approaches and solutions. Assuming from the outset that it's the only way to address childhood unhappiness without looking at a wide range of less intrusive, less life-altering interventions is bad education, bad medicine, bad therapy, and bad public policy. I'm Dr. Marty Klein. Thanks for joining me today. You know, I drop a video quickie once every 3 or 4 weeks, so if you want to get pinged when I do, just click the subscribe button below and you'll hear about it the next time I do. Thanks for joining me.